Thank you. Respiratory infections are the most widespread cases of infections. The disease is mainly limited to the upper respiratory tract, but a small percentage can also progress to the lower respiratory tract. Children and the elderly are the most risky ages. The year 2023 began with a significant wave of cases of respiratory tract infections, including a combination of viruses such as influenza A and B, COVID-19, and respiratory syncytial virus. Respiratory infections, including those classified as Sars Cov-2 and influenza, have shown symptoms, including fever, fatigue, and cough. Symptoms of COVID-19 and influenza are often difficult to distinguish based on clinical presentations. Therefore, testing advanced methods such as PCR has taken a central role. To cope with the spread of these viral infections and to help in the treatment of infections, the polymerase chain reaction testing has taken on great importance. This method is sensitive and specific compared to other diagnosis tests, being a key tool to correctly identify the type of virus and guide therapy. Through this method, testing can not only distinguish between viral infections, but can also identify the exact subtypes of specific virus variants which have implication for disease, prevention, and treatment. Let's discuss something about materials and methods. About 1,550 swab samples have been collected during January 2023 until January 2024 in 24 different areas around Albanian state. For each sample, we have filled a questionnaire about their symptoms and clinical anamnesis prescribed from a medical doctor of a healthcare center. Every patient has been notified about the study and the aim, and once they accept to use their data, we have continued with sampling. After samples collection, RNA purifying procedure was performed from a Kiagen viral RNA mini kit with instruction followed as described on instructions of usage. Testing of these viral stains is performed over real-time SARS-CoV-2 and influenza A and B, and steps performed as described on the instructions of usage. And regarding of this instruction, the test is based on one-tube reaction comprising reverse transcription to convert viral RNA into complementary DNA, followed by PCR amplification and fluorescence-based real-time detection of two defined sections within the ORF1A, and N genes of the SARS-CoV-2 genome, as well as one defined section each in the genomes of influenza virus type I and B. Reverse transcription amplification, the detection of cDNA of SARS-CoV-2 and influenza virus types I and B are carried out by means of SARS-CoV-2 specific primers and probes. The test contains an internal amplification control, which serves as an inhibition control and can additionally be used as an external control. The test kit includes a SARS-CoV-2, influenza A, and influenza B positive control that is used also as an external control in every test run. Other data have been exported into Excel for further analysis that will be discussed in another time. SARS-CoV-2. Out of 1,500 tampons tested, 292 turned out to be positive cases with COVID-19, which were then grouped based on age and gender. The division by gender resulted in 117 men and 175 women positive with COVID-19, while by gender, in an irregular distribution of cases. The tests performed to confirm the presence of SARS-CoV-2 virus were carried out during the months of from January 2023 until January 2024. During these months have been a change in the number of tests performed compared to the number of tests with positive results confirming the presence of the virus. The month of September makes the highest number of positive SARS-CoV-2 tests, and as you see, we have a predominance of the female sex. The viability of the virus in the environment is influenced by several factors, including climatic parameters such as humidity and temperature. Temperature has been proposed as a factor that affects SARS-CoV-2 transmission. Previous studies found that the temperature affected the transmission of SARS-CoV-2, in which high environment temperature reduced the number of COVID-19 cases. This is the reason why in June and July are the months with the lowest number of cases. The relationship between COVID-19 and atmospheric temperature has been extensively researched worldwide. During these years, understanding the impact of seasonal temperature changes on virus transmission was an important factor in reducing the spread of the virus. Influenza A. Both type A and B influenza viruses regularly spread among people and responsible for seasonal flu each year. The disease occurs through the year with a greater frequency during the winter due to lower resistance of the mucous membranes of the respiratory organs and the greater presence of people in narrow spaces and close to each other due to cold weather. From 100 positive cases with influenza A, the division by gender resulted in 43 men and 57 women positive with influenza A. Even in the case of the influenza A, we have a predominance of the female sex, as in cases with COVID-19. During June, no case of influenza A was identified, while in July and in August, the number of cases were low. The largest number of cases appeared in January and is dominated by the female sex. Influenza B virus, which also causes acute respiratory infection, has increased in prevalence in recent years. Influenza virus can spread to other before and after a person shows signs and symptoms of being sick. In the case of influenza B, we have a predominance of the male sex in contrast to COVID-19 and influenza A. From the data analysis, there were 39 positive cases with influenza B, which were then grouped based on age and gender. The division by gender resulted in 22 men and 17 women positive with influenza B. The largest number of cases appeared in January and is dominated by the male sex, but a larger number of people affected by this virus appears from January to April. Then a decrease is noticed, and during the 3 months of summer, with the increase of temperatures, no cases of influenza B have been identified. Respiratory syncytial virus is the most common virus that causes lower respiratory tract infection in infants and young children worldwide. Respiratory syncytial virus is mainly transmitted by droplet or direct contact, and the population is generally susceptible. People of all ages are susceptible to this virus, but sometimes symptoms vary. Infants, especially infants aged 2 until 6 months, are very sensitive to respiratory syncytial virus, which often causes serious respiratory diseases such as bronchiolitis and pneumonia. It is the most common cause of bronchiolitis and pneumonia in children younger than 1 year of age. Virtually all children we have been infected with respiratory syncytial virus by the age of 2, and reinfections are common throughout life. Since antigenic variation, which is frequently observed among other respiratory viruses, such as SARS-CoV-2 or influenza virus, can only be observed for respiratory syncytial virus to a limited extent. Reinfections may result from short-term or incomplete immunity. As you see, respiratory syncytial virus appear with the smallest number of cases. There is no difference between the sexes, and the peak season is from November to April. The emergence of different variants of SARS-CoV-2 has further challenged the world's health system, including the need for repeated vaccination and the development of new treatments to combat the new variants. While advances in PCR testing have been improved diagnostic capabilities, accuracy in the proper treatment of respiratory tract infections require deep understanding of the differences between these viruses to ensure patient recovery and to prevent potential complication. Thank you for your attention. It was my third presentation, so maybe it was useful for you.
Thank you so much, Migena. It was a nice presentation, though. If anybody has a question, they can ask right now from our listeners.